Thank you for visiting Diabetes in Pregnancy. We're thrilled you're here to learn how to stay healthy during your pregnancy. For more expert tips and weekly videos, please subscribe to our channel and hit the bell icon to never miss an update. Today, we're covering Diabetes in Pregnancy, your guide to a healthy pregnancy. You'll learn the essentials of managing gestational diabetes, from understanding its causes to practical steps for a healthy pregnancy to keep you and your baby safe. Let's get started. Gestational diabetes, or diabetes in pregnancy, occurs when your body can't produce enough insulin to manage blood sugar levels, typically developing between 20 and 24 weeks of pregnancy. This happens because hormones from the placenta, like human placental lactogen, increase insulin resistance, causing blood sugar to rise. Imagine insulin as a key that unlocks sugar for energy, but during pregnancy, that key becomes less effective. If not managed, this can lead to risks like macrosomia, where your baby grows larger than average, increasing the chance of delivery complications. It can also raise the risk of premature birth or preeclampsia, a condition involving high blood pressure that can be serious for both you and your baby. The great news: with the right approach, most women can manage gestational diabetes and have a healthy pregnancy. The American Diabetes Association notes that about 70 to 85% of women control it with lifestyle changes like diet and exercise, while some may need medication. Let's dive into what you need to know to take charge of your health. First, understanding why gestational diabetes happens is key. During pregnancy, your body needs more insulin to handle the increased sugar in your blood. If your pancreas can't keep up, blood sugar rises. Risk factors include being overweight, having a family history of diabetes, or being over 25 years old. Certain ethnic groups, like African American, Hispanic, Asian, or Native American women, also have a higher risk. But even without these factors, anyone can develop gestational diabetes, so awareness is crucial. Let's talk about spotting the signs. Symptoms can be subtle, as they often overlap with normal pregnancy changes. One common sign is excessive thirst, even after drinking water. High blood sugar causes your body to flush out sugar through urine, dehydrating you. You might notice yourself refilling your water bottle constantly or waking up thirsty at night. Frequent urination is another clue. While pregnancy already increases bathroom trips, gestational diabetes can make this extreme, like needing to pee every hour or waking up multiple times at night. Fatigue is also common. If you're feeling drained despite getting enough rest, it could be because your body isn't using sugar efficiently for energy. Blurred vision might occur as high blood sugar affects the fluid in your eyes' lenses, making it hard to focus. You may also experience genital itching or frequent yeast infections, as high blood sugar creates a breeding ground for bacteria. If you notice any of these, don't panic, but do talk to your doctor. They'll likely recommend a gestational diabetes test, typically done between 24 and 28 weeks. This test, called the oral glucose tolerance test, involves drinking a sugary solution and checking your blood sugar levels after an hour or two. It's simple and helps catch issues early. Now, let's explore how to manage gestational diabetes, starting with diet. Eating for stable blood sugar is about choosing low glycemic foods that don't spike your levels. Think whole grains like quinoa or brown rice, non-starchy vegetables like broccoli or spinach, and lean proteins like chicken or tofu. For example, instead of white bread, try whole grain bread or swap sugary snacks for berries, which are low in sugar but sweet and satisfying. A sample breakfast could be oatmeal topped with almonds and a sliced apple, paired with a boiled egg for protein. Aim for smaller, balanced meals every 2 to 3 hours to keep blood sugar steady. Avoid sugary drinks like soda or juice, and limit high-carb foods like white pasta or sweets. Working with a dietitian can help you create a personalized plan. Exercise is another powerful tool. Activities like walking for 20 to 30 minutes a day after meals can help your body use insulin more effectively. Gentle yoga or swimming are also great options, but always check with your doctor before starting a new routine. Monitoring your blood sugar is key too. Your doctor may give you a glucometer to check your levels at home, typically fasting in the morning and after meals. Target ranges are usually 95 mg/dl or lower when fasting and below 140 mg/dl an hour after eating, but your doctor will set specific goals. Keeping a journal of your meals, activity, and blood sugar readings can help you spot patterns and share useful info with your healthcare team. If lifestyle changes aren't enough, Some women need medication, like insulin injections or oral drugs like metformin. These are safe during pregnancy and help keep blood sugar in check. Let's make this real with a story. Meet Sarah, a 32-year-old expecting mom who noticed she was thirstier than usual and constantly tired. She mentioned these symptoms at her prenatal visit, and her doctor ordered a gestational diabetes test at 26 weeks. After testing positive, Sarah was nervous but proactive. She met with a dietitian who helped her switch to low glycemic meals, like grilled salmon with quinoa and steamed veggies for dinner. She also started walking 20 minutes daily after lunch. Sarah tracked her blood sugar with a glucometer, and within weeks, her levels stabilized. By delivery, her baby was healthy, weighing 7 pounds, and Sarah felt empowered knowing she'd managed her gestational diabetes well. Stories like Sarah's show that with the right steps, you can protect your health and your baby's. Beyond diet and exercise, managing stress is important, as stress hormones like cortisol can raise blood sugar. Try deep breathing, meditation, or even a warm bath to relax. Getting enough sleep, aim for 7 to 8 hours, also helps regulate blood sugar. Support from family, friends, or a gestational diabetes support group can make a big difference too. Let's talk about what happens after pregnancy. For most women, gestational diabetes goes away after delivery, but you'll need a follow-up blood sugar test 6 to 12 weeks postpartum to confirm. Having gestational diabetes also increases your risk of type 2 diabetes later, so maintaining healthy habits long-term is key. Breastfeeding can help regulate blood sugar and supports your baby's health too. For your baby, good management reduces risks like low blood sugar at birth or obesity later in life. To wrap up, today we covered diabetes in pregnancy, your guide to a healthy pregnancy. You learned how gestational diabetes develops due to insulin resistance, how to spot symptoms like thirst, fatigue, or frequent urination, and practical steps like eating low glycemic foods, exercising, and monitoring blood sugar. We also discussed the importance of early testing, like the gestational diabetes test, and how stories like Sarah's show that proactive steps lead to healthy outcomes. We're here to empower you with clear, reliable advice for a healthy pregnancy. Comment below, have you noticed any symptoms or tried these tips? Let us know. Subscribe to Diabetes in Pregnancy for more videos on gestational diabetes symptoms, diet, and tips. Check out our playlist on gestational diabetes management for more ideas. Follow us for daily pregnancy health tips. Always consult your healthcare provider for personalized medical advice. Thanks for watching and see you in the next video.